Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Assalamu alaikum. I am from Zainal Umar Art News channel and Kashmir News Network, Islamabad. Today our topic is health care quality, a fundamental right of the patients. The purpose of this program to promote awareness amongst healthcare providers, healthcare recipients, and how enforcement agencies about responsibilities of healthcare providers, right of healthcare recipients, and role of how enforcement agencies. Today, here, sitting Sardar Khan Jaspal Sahab, whose BA, LLB, Postgraduate Diploma in Hospital Administration and Management, Certified Professional in Healthcare Quality from National Association for Healthcare Quality, USA. Worked on post of Healthcare Quality Director in Ministry of Health Hospital in Saudi Arabia for about 22 years and in private hospitals for 3 years. Worked at Shifa International as a healthcare quality manager for about 1.5 years. Main functions were preparing hospitals for accreditations from national and international accrediting agencies, i.e., JCI, CBEHI of Saudi Arabia, by preparing SOPs, policies, and procedures, plans, protocols, programs, educating the staff about it, implementing and monitoring the health quality programs as a whole. Assalamu alaikum.
Walaikum assalam.
What is health quality? You please tell us an awareness about pupils and health. What do you know about health quality, and what are dimensions of quality of care?
Bismillahirrahmanirrahim. As we are going to talk about the healthcare quality today in this session, so healthcare quality is the art of providing the care in the way that ensures the appropriate outcome of the healthcare and reduces the risk of to the patient and harms to the patient. This is the most popular definition of healthcare quality, although there are so many other definitions, but this is the most popular of healthcare quality. And what are the dimensions? Dimension means how we can see that this care was qualitative, which was provided to the patient. If we go for this one by one, there are certain dimensions by which we can know that the service provided to the patient was qualitative. One is the accessibility. If the patient was easily could approach to receive the care or not, or there are so many obstacles and it is very difficult for the patient to reach to the to receive the care, health care. The number two is the appropriate. Was this care the appropriate which patient was needing the care to be provided, or it was not well diagnosed and patient was receiving inappropriate care? And also there is effectiveness. How much? What was the outcome? Was the outcome expected outcome we achieved the target of the patient or not? And other dimension is, was the care timely or not? Any care not given to the patient, it is late or it is not timely, it is earlier or later, is harm for the patient. Was patient treated respectfully or not? This is another dimension. And there are so many other dimensions, but these are the most popular by which we can know whether patient received a quality care or not.
Well, tell us please, what's a difference between negligence and mistakes about healthcare?
Negligence is doing something which a prudent person will not do in the same situation, or not doing something which a prudent person will do in the same situation. This is the definition of negligence. Otherwise, negligence, not doing a duty, what you are duty bound and you are not doing, this is the negligence. And difference between negligence and mistake. Mistake is accidental and negligence is totally because of carelessness.
Okay.
So this is the difference. And both are punishable, both are accountable, but the negligence is more accountable than the mistake.
Okay. Um, our fourth question is MBBS doctors is Bachelor of Medicine and Bachelor of Surgery. Why he or she can't perform surgeries and give medications to all type of patients? About now, you please tell the medications and about patient because we see many patients they disturbs about doctors medicine and I think they don't know how to choosable suitable doctor, suitable medicine,
Yeah.
how to get.
Actually, this is the dilemma in our society that a general impression because of unawareness about the medicine among our population care recipient, that MBBS doctor is a doctor, can treat any disease, can operate for any surgeries. This is not the true.
Okay.
Actually, Bachelor of Surgery and Bachelor of Medicine is just MBBS is a basic knowledge for
Yes.
which the MBBS doctor has only very limited privilege to practice.
Okay.
After that, every doctor is to go for a specialty to treat in their specialty. There are so many specialties: ENT, obstetric and gynecology, general surgery, internal medicine, and so on, psychology. So all the doctors which want to practice beyond the basic medicine are to go for a specialization. And in also specialization, there are stages. Is any doctor going for specialization, FRCS, MRCP, or diploma, only becomes a resident and practice within the expertise. And then after certain period, if certified by other professional person, can practice as a specialist, then go for the specialties and super specialties. And all the doctors can only practice within their expertise level. It's not like that any doctor becomes MBBS and he becomes a doctor of everything.
Everything.
Yeah.
Well, okay. If patient is harmed by care provider, what is remedy available with patients to redress? Now you please aware the pupil through this channel. What is and that which forums are available with harmed patients to redress his grievances?
Actually, there is a principle of law.
Yes.
Where there is a wrong, there is a remedy.
Yes.
So is the case with the medical practice also. Anybody harmed by the medical practitioner have equally right as others harmed by any other person or any other incidents. So in our society, again, this awareness is very less amongst the people receiving the care. If it is known to the care providers, they do not also accept it really. So there, there is a remedy for if a patient treated by a doctor is harmed by the negligence, not in the general process of care, but by the negligence, again I repeat, can go for the remedy. He can go for criminal procedure. He can go for civil procedure. He can. There are forums. There is a civil court. There is a criminal court, and moreover, there is a Punjab Healthcare Commission. From there, patient can complain, and there is also a consumer protection court, which is also in our city here. A session judge is sitting there, and there are law on it other than PPC and CPC. There is a Punjab Protection, Punjab Consumer Protection Act 2005, which provides the remedy to the harmed patient and to other service recipients. And there is also this one now. Another act is there. This is the Punjab Healthcare Commission Act 2010 that also provides the remedy to aggrieved patients.
It's the latest act in 2010.
2010.
Okay.
Ji.
Our question: consent from patients that if patient is harmed, then patient will not go for legal action.
This consent is really, I have seen so many, this consent in so many hospitals locally here. This consent is substandard, does not fulfill the international requirements and legal requirements.
Okay.
Actually, the consent is a contract between the patient and the care provider. It should be two-sided. The patient is to pay for the services and the care provider is to provide the quality care. They get it signed by the patient, and when the if patient is harmed, will not go for the legal action, etc. This really is totally wrong. It is not according to the international standard. It is not according to WHO standards. Even it is not according to the Punjab healthcare standards. So if even a patient, this doctor care provider has get signature from the patient or guardian that they cannot go for any legal action if patient is harmed, still patient have the right to go if this harm is because of the negligence. There is a provision if there is a provision in Punjab Consumer Act also. There is a section which covers that any contract or any consent or any notice by the care provider do not provide the care provider immunity from the negligence and harming the patient.
Okay. A layman patient mostly doesn't know that which is appropriate doctor for his care.
Really, it is true in our society, almost 80 to 90% patients do not know which is the appropriate doctor to whom he or she should go for the treatment. They usually go to the general practitioners, except a few, those know where they should go. So this is the duty of the first attending physician, doctor. If the patient's care is needs beyond his or her expertise, they are to guide and refer the patient to appropriate If they are not doing this, this is another type of negligence. Really, I am thankful to the media and I am thankful to the listeners also. Actually, I achieved this expertise by working long life in the foreign countries with the foreigners, with the Westerns. I wish to convey this art and this awareness in my country, in my society. So this was a very good opportunity for me, and I will keep availing this opportunity if I am given the chance.
Well, thanks. Now, do you want to convey any message to the public?
Yes, actually, first of all, I am very much thankful to Zain Al Omar News Channel and the Kashmir News Network to give me the opportunity to convey my this long life expertise which I achieved by working in the foreign countries with the foreigners and westerns. So this is my gratitude to the media. And now I want to say something to the care providers. Please provide the care to the patient within your expertise. Do not go beyond your expertise because by that you can harm the patient. And also guide the patient to appropriate expert doctors. And to the public also, you have a right of quality health care from the care providers. You are paying for it. You have every right. If you are harmed by the care provider, you have a right to redress, to remedy your grievances through the legal processes, which I already mentioned in my interview, the available forms for that remedy.
Okay. Thank you so much.
Thank you.